Welcome back, everyone. We're going to continue down our genitourinary series with talking about acute genitourinary emergencies. First and foremost, let's talk about pain. Pain in the genitourinary system can be referred to as either visceral pain, which is pain localized to the area that's infected, or it can be referred pain. And abdominal pain, genitourinary pain, regardless of the pain that's being experienced by the patient, pain requires pain management and pain treatment, and we'll talk about that here in just a second. One note with referred pain is this is common with interior organs that are deep within the mesentery or even in the genitourinary system, in which that pain coming from a specific organ may be referred or felt elsewhere. So, for example, a patient who is experiencing shoulder pain may indeed have inflicted abdominal pain that's creating that, but because of the nervous system structure, it's felt elsewhere. This is also common we hear in cardiac patients where pain may radiate up to the neck or lower jaw in a patient experiencing an MI. Pain management is subjective and sometimes controversial within EMS and within medicine. One of the things that's important for the EMS providers to recognize about pain in general is that pain is not the perspective of the provider. What I mean by that is that your ability to assume a patient's level of pain based on your own experience is completely irrelevant. And pain management should be sought if the patient is indeed in pain. Now, the route of which pain management we may choose to go could vary from provider level and from patient to patient. When we talk about trauma, we'll talk about how splinting and immobilization is indeed a form of pain management. Letting the patient assume a position of comfort can be a form of pain management. But when basic or non-invasive forms of pain management aren't working, then a higher level of care should be sought. And for advanced level providers particularly, pain management should be a consideration for all patients that are within pain. Pain is not just a feeling or an emotion. It causes the secretion of hormones and chemicals in the body, including a nervous system response by the sympathetic nervous system, which reduces the body's ability to heal, the release of cortisol or the stress hormone, the increase in heart rate and potential reduction of cardiac output due to various neurotransmitters being submitted. So pain is something that is worth treating, and we should treat appropriately and accordingly. Be aware if you're an advanced level provider and you're using pharmaceutical agents to treat pain, that patients may experience nausea and vomiting with pain medications that you're administering, so you should be prepared to treat accordingly. Establish an IV line, consider antiemetics such as Zofran or Phenergan for patients that are experiencing nausea and vomiting. Abdominal pain is no different than any other pain, and we shouldn't withhold pain management just because a patient has pain in the abdomen or pain due to menstruation or cramping. Keep in mind that our job is to treat our patients, and pain is a symptom, and symptoms need to be treated accordingly. All right, with that, let's move on to some of the other genitourinary complications that we may see that are less chronic and more acute. Firstly, we'll talk about urinary tract infections. UTI are a very uncomfortable process. They are more common in females than males, and this is simply due to the length of the ureter and the urethra and the distance between the internal urinary components and the external environment. It usually develops in the lower urinary tract and can spread up to the bladder and into even the kidneys if left untreated. Definitive treatment requires antibiotics, but awareness of this should be upon the EMS provider, especially if the patient is using urinary catheters or has had a recent urinary catheter. UTI in immune-compromised patients are a significant correlator to things like septicemia and significant infections later. So recognition and getting these patients to definitive care where they can be treated appropriately is important. For many patients, they're hospitalized after a urinary condition or a disease will receive catheterization via Foley catheter. And you can see an image breakdown here of a Foley catheter in a male and a female patient. And then there are some other complications along with UTI if it was not placed aseptically. If a patient has a urinary catheter during transport, make sure that the catheter bag is placed below the urethra and ureter to ensure that there's no urine backflow. This can create, this is another cause for infection and further complication. So make sure that stays below the level of the patient's urethra. Urinary obstruction and incontinence. You've got urinary retention, which is an incomplete emptying of the bladder or an inability to empty the bladder. And then you can have urinary retention. Some causes for this can include things like kidney stones or renal calculi, acute kidney injuries, BPH or benign prostatic hypertrophy. Urethral obstructions, UTIs, and nerve damage can all cause additional retention problems. Let's talk about kidney stones for a minute. This is when renal calculi form within the renal pelvis and then they're passed through the urinary system. They typically form when an excess of insoluble salts or uric acid crystallize within the urine. Kidney stones are extremely painful. There are, often touted as there are three great pains in life: a heart attack, childbirth, and then kidney stones. These patients will often be writhing in pain and unconsolable pain. Occasionally, the pain will originate in the flank and then travel around the flank into the area of the bladder or the ureter or urethra. Ultimately, these kidney stones have to be expelled. Let them assume a position of comfort, and pain management is crucial for these patients, particularly for AMTs and paramedics. You may consider non-opioid pain management. Opioid pain management doesn't really do great for these patients. It tends to not give any relief, but Toradol is extremely effective in managing pain associated with kidney stones. So if you have that at your disposal, it should certainly be of consideration if your certification level allows. Some of the male genital tract conditions that we may see, you have epididymitis. Tough word here. Epididymitis is an infection that's caused by inflammation of the epididymis along the posterior border of the testes. With orchitis, you can have one or both testes becoming infected. And prehospital management for these patients is supportive. Ensure a position of comfort. Try and provide support for the testicles so that the patient's not having them pull or stretch. They can swell to an immense size. And so during inspection or during assessment, you may note that they are grossly oversized and swollen and extremely painful. Fournier's gangrene is caused by necrosis of the subcutaneous tissue and muscle within the scrotum. The scrotum will be tender, warm, and erythematous, or a grayish and black color. Aggressive treatment with IV fluids are required for these patients, and prompt transport is indicated. Priapism is a painful, tender, persistent erection. This can be caused by any number of problems, including medication, over-medication use, general circulatory compromise, or underlying trauma. Treat the patient with respect and try and ensure the patient's privacy and dignity. If you suspect that priapism is a result of spinal cord injury, so if the patient has sustained trauma, this can be an ominous sign for spinal cord injury. So you may need to take appropriate measures to restrict spinal motion. And pain management, again, is important here. If you don't have pharmaceutical pain management for your certification level, comfort measures are still important here. Let the patient assume a position of comfort. Try and give an easy ride to the hospital. Priapism is going to require definitive care and treatment, so this is a patient that's going to need to be transported. Ultimately, they may try pharmaceutical agents, or they may have to use surgical procedures to drain the blood from the penis to reduce the priapism. Other male genital tract conditions include phimosis. Phimosis is the inability to retract the distal foreskin over the glans penis. And this creates a problem, one, with urinary retention and a potential for infections and swelling. It's extremely painful. These patients, you can apply a cold compress to try and reduce some of the swelling down, but they'll certainly need transport and, again, consideration for pain management. Another male genital tract condition is called periphymosis. And this is where the foreskin is retracted over the glans penis, but it's become entrapped. And so, where the foreskin would normally retract across the glans penis and then return itself to its normal state, there's been an error or something has occurred, or potentially trauma or infection, where the foreskin is retracted over the glans penis and can't return to its shape. This is a true emergency. It can cause or can result in necrosis of the glans penis and ultimately require amputation if not treated promptly. You can treat this essentially like a tourniquet, is the sort of the underlying principle that's occurred here. So no blood flow is able to enter or exit the glands. Benign prostatic hypertrophy or benign prostate hypertrophy is an age-related, non-malignant, so non-cancerous enlargement of the prostate gland. It can be asymptomatic, but it can lead to things like difficulty starting urine flow, incomplete emptying of the bladder, increased urinary retention, and increased urination at night. Testicular masses rarely require prehospital treatment, but again, it can be painful or it can be painless. Most of these are benign cystic masses or variceals. Testicular cancer usually presents as a painless solid lump, but again, evaluation is going to be important at a definitive facility here. The last one we're going to talk about is testicular torsion, and this is a rotation of the testicle against the spermatic cord. Much like periphymosis, this restricts the blood flow to the testes, periphymosis being the glans and testicular torsion, the testes respectively, but it reduces blood flow and can cause significant long-term damage. It's typically unilateral, meaning that only one of the testicles are involved, but transport carefully and promptly. Pain management, again, is important here. And you need to try and assess the level of pain and level of swelling and make sure that you convey that information to the receiving facility appropriately. This is more common in pediatric patients than it is adult patients, and so that's going to further complicate your assessment, particularly if it's in an infant that can't speak to you. So assessment is going to become important. History from the family is going to be important, and then making sure this patient is going to an appropriate pediatric care facility. Testicular torsion, periphymosis, any of these acute restrictive diseases or circulatory restrictive diseases, these patients shouldn't be going to outlying or lower level community style hospitals. They should be going to a larger facility if it's available to them.